Hello, everyone, and welcome to Globo's Conversation at the Lab, hosted by Globo's Innovation and Experience Lab. In this series, we host conversations with language access leaders, thinkers, and those driving to improve experiences for the limited English speaking and deaf and hard of hearing communities. Because we believe that language access is a right, and not only a right, but a superpower. I'm your host, Francesca Mayer. Let's start the conversation. Today, I am joined by Ligia Gutierrez. Ligia is an advocate for language access, known for creating this best practices group, which we'll hear a little bit about. And I'll let Ligia introduce herself and tell us more about her background and experience. Welcome. So excited to talk to you today.
Thank you. I'm excited to be here. So yes, my name is Ligia Gutierrez. I am the Language Services Program Coordinator at Ochsner Health in New Orleans. I started as a PRN interpreter, and I'm actually fairly new in the field. I've only worked for Ochsner for 7 years, and before that, I did my interpreter education. It took me about 18 months to finish. It was in person at Loyola University. I did about 2 years as about a year or 2 years as the PRN interpreter, and then in 2019 our leadership changed, and so our leader asked me to help her centralize our language services within the system. So thanks to her, I am where I am now. And since 2019, we've done a lot of work. We've been able to centralize our language services. We were able, to create different processes and procedures to make the language access better for all of our patients. We've provided education. We've, changed policies. It's a lot of work. Besides the work I do at Ochsner, I also work with the Louisiana Language Access Coalition, trying to improve language access in the state. And then, like you mentioned, I also have the best practices group that I am the organizer of. I created it in 2019.
Which is amazing. And we have lines of questioning later. We'll
Yeah.
talk more about that. I wanted to ask a follow-up question about the centralizing of language services, which was not originally something that I had planned to talk about, but you have me thinking about it.
Mhm.
Why is it valuable? Why do you think it was important to centralize language services?
With the large system like Ochsner, it's important for several reasons. So first of all, it ensures that every single one of your facilities does the same thing. At the end of the day, when you have a large health system, you want to make sure that everybody works the same and they have the same kind of quality in the services that they provide. But other than that, you also want to make sure that everybody is compliant. So when you have different facilities doing their own thing, you have different levels of compliance going on when you provide the services. So maybe one facility will be like, we can just use the cleaning lady. And then the other one is specifically trained to know, no, we need to have a professional interpreter. So it's always important to be able to centralize, because that way you can provide the education that's needed. You can change the policies. You can make sure that they understand the reasons why. Just that, so that everybody it's a unified front and everybody provides the same quality of service.
It makes a lot of sense. Also, so I'm a human-centered designer. I went to school for design, visual design, and experience design. And so that's the lens that I'm looking at language access through. And it's interesting because a lot of the time, the things that designers talk about end up being the same kinds of things that language access people talk about. So there was a big thing a couple years ago about do you centralize your design org inside of not a design agency? Do you have your brand designers and your communication designers and your user experience designers sit together? Or do you have them sit inside of different organizations? Or what does that model look like? And why would you choose one over the other? And it's the same thing. The reason why people choose to put their designers together is so that we have a center of excellence, that there's quality control, that there's consistency, which doesn't mean that you can't have that if it's not a centralized model. It's just so much harder to achieve. And just by having them in the same organization, it naturally does it instead of having to on purpose, get the word out.
It's also more cost effective, because by us providing the education, we're able to provide education on the type of interpreter services that you should use for certain situations. Of course, in person is, everybody prefers in-person interpreters. But we can't act like OPI and VRI are not just as good. They're just as good. That's one thing that COVID has taught us, is that video remote interpreters and over the phone interpreters are amazing, just as amazing as our in person. And there's certain situations where, because it's more cost effective, it's the best resource. For example, to when you have a patient in front of you, patient registration, it is more cost effective to use the phone than to have somebody come in and do the registration for you.
Mhm.
So, uh, so yeah. So besides centralizing and making sure that the quality and everything stays the same, it's also more cost effective for the system.
Makes total sense. What do you think? You mentioned that people love on-site interpreters, that they just tend to prefer in person. Why do you think that is? And also, you mentioned that you see that changing. I'm curious to hear more about that. Tell me more.
Well, the reason people prefer in-person interpreters is because of the experience. As an interpreter, when I walked into a room and the patient saw me, a person who looks like them, who speaks their language, their face lights up, because they're able to communicate. They feel more comfortable with somebody who looks like them, who speaks like them, who understands them culturally, rather than having a phone there that you don't know, who that person is, what they look like. The other thing is, particularly for health systems, we have a lot of the same patients over and over again. So we start creating a connection with them, which at the end of the day helps when you have difficult situations, like, babies who were born with complicated situations, or things like that. So it helps create a relationship. It also helps with, when at least I've noticed, for particularly our patients who are inpatient, the interpreter is able to evaluate better whether the patient or their family members are understanding what's being told to them, especially when it's like a bad diagnosis.
Mhm.
We tend to shut down. We tend to lose a lot of information that's provided to us at the beginning. And so many times the in-person interpreter is able to see the cues, and they're able to work with the provider to make sure that that the information is being relayed and everything is being understood the way it's supposed to.
It makes a lot of sense. And also, I think there's um like a broader question. We talked about this a little bit last time with Prado, who's also, we both know Prado. She's part of the
Mhm.
Language Access Council, which you're also a part of, which is very exciting.
Mhm.
Um, but we talked with Prado last time about the future of language access and what we think might happen with the role of the interpreter. Like how will the role of the interpreter change over time? And we had a couple of thoughts about what we thought would become like necessary in order to differentiate a human person versus
Mhm.
technology will eventually catch up to the language piece, not
Mhm.
ever to the extent that a person can do the language piece, but for certain things. And so what would I don't think there's any question about the fact that a person will still be preferable in most cases. Almost 100% of the time, I think a person would be preferable, especially inside of healthcare. But what will the person need to do differently in order to make it meaningful that they're a person instead of it being machine translation or artificial intelligence, or in language conversations happening through an IVR? Like all of that stuff is great for maybe scheduling, and we might gain more confidence in it over time. But there's also a human part that you need the
Mhm.
person for, and it's the discernment piece. It's the cultural awareness piece, and it's the connection and making people feel safe piece too.
Yeah, it's empathy. So when I started, of course, they teach you, as an in-person, as an interpreter, you have to be impartial. You have to advocate only when the patient's life is in danger, things like that. As I've started working here, and even with a lot of the interpreters that work here that are a lot more sensitive to those situations, because I'm able to shut myself off and be, do my job and do it right, and be empathetic, but at the same time have that professional barrier.
Mhm.
But we have other interpreters who are a lot more sensitive and a lot more empathetic, and what I've come to realize is, as interpreters, we kind of have to have that empathy, and we have to have that human side to be able to help our patients as much as possible, because even though um the nurses and the doctors, they do care, they sometimes they don't notice, or they they can't help the patient as well as somebody who understands their situation, first of all, because most of us who work at Language Access, we've had family members who have needed it, or we've interpreted for our parents, or, not me, myself, my mother is bilingual, but we've had that situation where we understand the why,
Mhm.
which for me is a big thing. Um, a lot of times it's difficult for people to understand the why it's so important to not just whip up Google Translate and, you know, do the voice to text for it to translate whatever you're saying. It's a big thing. I honestly think that the interpreter role has evolved and will continue to evolve into a more empathetic role, that is not only there to interpret everything that you say the way that you say it, but that is also there to provide the care that the patient needs and to teach our the care team, how we can help our patients. A lot of our patients come with different issues, social issues, economic issues. They have a lot more difficulty, especially when you're in a country where you don't understand the language, you don't know anybody, you're by yourself. We have, certain needs that the interpreters understand, and I believe that they make a real big difference for our patients.
And I was going to ask you specifically about that. So I know like the NCIHC, and I'm not an interpreter by training, so all of this is kind of new to me. I don't speak another language, at least not very well. I took a lot of Spanish, but don't try me on it. I know the NCIHC, I believe it's the NCIHC, publishes they have like that graph that shows the amount of time that an interpreter should be a conduit, and then it's like very little amounts that they should be a cultural broker, a clarifier, or an advocate. And I think they get smaller and smaller. So it's cultural broker, and then clarifier, and then cultural broker, and then advocate is the least. And it seems like, as I'm talking with people, there might be some evolution of the way that people
Yeah.
are about that. Like, you might not always be acting as a straight conduit. You might always,
Mhm.
if you're an interpreter, you might not always even be acting as the interpreter, but because you're present, you kind of can play a bigger role. And I think
Mhm.
that's exciting. And I think that it's a transformation from the way that people have thought about it historically.
Yeah, so every situation is different. If you
Mhm.
go into a normal 30-minute annual visit that has no complications, no issues, perfect. You are there to be the conduit. But we see a lot of situations where we have, complicated pregnancies and complicated births, and we have a lot of cancer in Louisiana. So it's kind of difficult to just be the conduit when you're in that kind of situation, because we are human and these people need support. So I do believe that there is a line that we have to draw. I do believe we have to maintain a professional distance from our patients, because at the end of the day, they are our patients and not our friends.
Mhm.
But I also think that we can do more than just repeat what's being said. We can help them in different ways. We can try to guide, whoever to find better methods of helping the patient. I don't think that maybe we should do it ourselves,
Mhm.
but we can talk to the care team. Doctors and nurses, they're very empathetic to their patients, and if they understand what they need, um, more than likely they will be willing to help go the next step and help get with the patient with, whatever they need. But for that, the interpreter kind of has to step in a little bit out of their role and be like, hey, look, this patient needs this, or this patient's not understanding that, or, situation, things like that. But it depends on the situation. And it's a fine line.
Totally. Well, and now there are roles that I'm starting to see pop up. I heard Geisinger speak about this at a conference like maybe a year or two ago. And there are others that it's not they're in-house interpreter roles, but they're not just interpreters. They're like
Mhm.
called something different, like language coordinators or language access specialists. And so the model seems to be that you have someone there that's really skilled in language, that's also a skilled interpreter that can do things like greet patients in their language, that can help them identify parking, that can be there for like customer service style questions in
Mhm.
language, things that you don't have to be a medical professional for. I think that's interesting. Like that seems like it's a good use of people's time, talent, and it speaks to the empathy piece too.
Yeah. No, interpreters are highly trained. Qualified interpreters are highly trained.
Mhm.
They see many different situations. Unfortunately, we don't have specializations within the interpreting field, like the healthcare interpreting field. You're either a healthcare interpreter or you're a legal or an interpreter who does more than one, but you're not a healthcare interpreter who is specialized in orthopedics or a healthcare interpreter who is specialized in, oncology. So we see many different situations, and I think that experience helps us help our patients better because we're able to see a little bit further or think a little bit more outside the box than if we were straight, if we were just doing our jobs.
Totally. Well, and everything impacts everything else.
Mhm.
The experience that you had in the parking lot is going to impact how you show up in front of the doctor. Like if you're freaked out from the beginning, if you're stressed out, if you have had to figure something out that is already kind of tough for you, and like it's like it could impact you even getting there. I'll share a personal story. One time, I'm not the best. I have no language barrier at all, but I'm also not the best driver. And that's not true. I'm not the best parker. I'm a good driver. I'm not great at finding parking, and I don't like to park in small spaces. And one time I was supposed to be at, it was just dinner. It was like casual dinner, but there was only street parking. And I went around the block like 5 times and I was like, you know what? Should I just bail? Like, is this worth it? I can stop looking for a parking spot and just go home right now. If that is happening to me, I can imagine that same thing is definitely happening if you speak a language other than English. It was harder for you to work up the courage to get there anyway, and all of the signs are not in your native language. Like, and then it's going to impact how you show up when you get into the facility.
Mhm. Well, I'll be honest. I do the same thing.
Mhm.
I don't live in New Orleans. I live on the outsides, and I avoid the city like the plague because
Mhm.
there's never any parking,
Yeah,
and I cannot stand going around looking for a parking spot in the middle of the street. It just, no. But yeah, I mean, our manager here, she likes always to ask, the first thing that she does is she'll ask you like, how do you think you would feel if you would be in China and you get sick and nobody understands you? Like put yourself in their shoes. So yeah, it's a big piece. A lot of I can't imagine being in a country where I don't understand anything, and then you're really sick and you're scared, and a lot of times you're by yourselves. And for example, we see a lot of young mothers
yeah,
alone, and so it's just I just can't imagine that situation, and then having the interpreter just come in and be blah, 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 and then just walk out without seeing how you're really doing.
totally. Yeah. Yeah. Well, kind of on that note, I want to ask you about what you're proudest of. What are you proudest? There's a lot of challenges and a lot of opportunities inside language access as a whole. What are you proudest of, either inside of that kind of space or just in general?
Oh my God. Since 2019, I'm proud of many things. I got my bachelor's degree. I'm getting an MBA right now. I'm
Oh,
in the
congratulations.
process of it.
Cool.
Thank you. But then I started the best practices group, which started as a simple question on a listserv, because we needed to benchmark. And so whoever answered the question, I was basically like, hey, do you guys want to join a group? And they were like, yeah. And we started with 4 hospitals and now we have about 14.
Cool.
We meet bi-monthly via Zoom for an hour, and it's just a conversation like the one that you and I are having.
Mhm.
There's really no agenda unless somebody asks for us to speak about a specific thing. But as soon as we start going, it's just on and on. And a lot of times we'll go over the hour because it's just so interesting to hear all of these different healthcare language access leaders, um, and the issues that they have. And, we're different sizes of health systems. We have small hospitals and big health systems, and, people who have 190 interpreters, and we have but 5. So it's very interesting to see all of the issues that we all have. We all have the same problems. Um, and to see how each system or how each leader is finding ways of like passing or going over those speed bumps that those the sorry going over the hurdles that they
Yeah.
face. And so we have a lot of conversations about that. We ask each other questions. The whole idea of the best practices group is to be able to share best practices. And so we meet bi-weekly, and then we also send email chains. And I'm talking email chains, these things are going out every day. Somebody has a question, and then so somebody answers and somebody else answers, and then we start having a full conversation via email. So that I have to say, within the language access, that's one of the things that I'm most proud of. I've never thought that I would be able to have something like that. But then also, you know, the work that I do outside of Ochsner, I really do think that improving language access is something that we should all take to heart.
Mhm.
At the end of the day, you know, these are they are part of our community. They're an important part of our community. And I think that we should all be able to at least make everyone's life a little bit easier by helping them understand their environment and to be able to help them to communicate better with other members of the community.
Totally. And also it's difference is important. So celebrating that we have people that are thinking differently. It's not
Mhm.
just us saying, hey, we want to make this easier for the patient, for these particular group of patients. It's also like we need them. They're part of our fabric of our lives, and their perspectives are different and valuable. And so difference is important, and it helps us when we grow together across different languages, cultures, backgrounds. It's all good. And the oh, I had another thought too. Um, and we also have to think about it as supporting the clinician too, because the clinician has a an obligation to be able to support to the best of their ability the patient in front of them, and that patient can be from any background, creed, language. And so it's also supporting, it's both sides, supporting the patient and
Mhm.
supporting the clinician. Lihia, tell me, if people want to join your best practices group, how should they go about that?
They can look me up on LinkedIn. We're currently formalizing in the sense that we are creating guidelines specific to what members should expect if you know when they become members. We have stated that we would only like lead members that are leaders in language access coordinators and above within healthcare. It doesn't have to be healthcare systems, but you know, within a hospital or clinic or things like that.
Awesome.
They can look me up in LinkedIn, Ligia Gutierrez. I'm not sure how many Ligia Gutierrez there are out there, but I'm pretty sure my name is not very common. Um, and I can send you my LinkedIn link if you want, and you can post it somewhere.
Great.
Um, but yeah.
That would be wonderful. I appreciate that. Okay, so my next question has to do with, I think, some of what your group is talking about, or maybe not talking about. What is the biggest opportunity in language access that no one's talking about right now? Like, what's the blind spot?
For me, it's the qualified bilingual.
Mm,
So a lot of hospital systems have qualified bilingual programs,
mhm,
which are great. I think they're amazing. I don't think that we are taking advantage of having these providers as much as maybe we should. I actually just asked within one of the email groups, what is if somebody had data on the savings, because it's not just savings of, you know, in-house interpreter versus agency, but it's savings of not actually using an interpreter because your provider speaks the language. So I've always said that the qualified bilingual program should be managed by like HR, and you should be able to match patients with providers to be able to get as much uh um to be able to take as much advantage
mhm.
of the quality of care that you're providing the patient. And you know, there's There's studies that say that being able to speak the same language concordance is better for patient and provider and the provider experience, not just the patient. So I think just the idea, just being able to have a good program where you can maybe have a list of providers that your schedulers can see and be like, oh, look, this patient speaks Hindi. Oh, look, we have a provider that speaks that same language, or we have a provider that has a nurse that speaks that language, that can at least do the triage part without having to call the interpreter, and then they can use an interpreter when the provider comes in. Or if the organization allows dual role interpreters, then they have that ability to use it. For me, that is one of the big things. I see that a lot of the health systems, they have really good bilingual programs. Some health systems allow dual role interpreters, some don't. I have my personal opinion about it, but I understand why the dual role interpreter. That would be one thing, and then the other thing is just taking advantage of the bilingual population. We don't have enough interpreters, and in my opinion, a lot of it is because nobody really knows that this field exists. I didn't know that interpreting existed until in 2017, 2016. One of my friends was like, hey, I'm going to take a course on interpreting. And I'm like, what? And so he told me about it. And that's how I started in this, because somebody mentioned it to me. And I knew that they had interpreters for like court and things like that, but I didn't know that it was an actual field where you have to study and you have to prepare yourself, and the law requires this and this. So I think that we don't take enough advantage of it. It's not marketed as much. We don't have enough people who are interested because they just don't know about it.
Totally. I didn't know that language access was an industry. Like, I knew that there were interpreters. Like, I knew that, like, okay, the UN has interpreters, like interpreters exist. But I didn't know that language access was an industry, or that companies like Globo existed where you could have like more than 300 languages under the same company. Until I applied at Globo, it didn't even cross my mind that it was a thing. And so I think that that's part of it too. I think that the way that interpreting is presented in mass media is really different than the vast majority of actual interpreting. Like, it's one of my pet peeves now when you were watching something and there's an interpreter and they're interpreting in the third person, drives me batty. I'm like, that's not real. You're not a real interpreter.
I was watching a show the other day where somebody was interpreting, and I'm like, oh, that's a terrible interpreter. So yes, but yeah, I had no idea it was the field either. I had no idea that's something that I could do, I could grow in. I have like a vision of what I want my future to be. Once I finish going to school and everything. And I had no idea. I was a leasing consultant for a apartment complex before I started interpreting. So, and before that, I had odd jobs. So, I had no idea that this is something that I could actually do and make money out of. I mean, I'm not rich, but make better money than I did when I was a leasing consultant. So there's that too.
Yeah. Well, and we offer training and qualification programs too. So we offer Bridging the Gap at Globo, and we offer other courses, like shorter courses that get people to a place where they're qualified as interpreters. And what we consistently hear is, especially like, people seem to pursue Bridging the Gap and they seem to know what Bridging the Gap is. But for geographies where it's just hard to find interpreters and we're doing outreach, like, hey, are you bilingual? Have you interpreted in this kind of capacity? Get this certification to be able to do medical interpreting. People just don't know. They just don't know that it's a thing. And so unless you're in it, like, if you're in it, you're in it. And if you're not in it, you don't know.
I've always said that I want to go like to high schools. You know how people go to high schools and they talk to kids about careers? Because when you start young, you can, if you start young and you find the love for the field, you can go places, and you can start interpreting and maybe do something else, and it'll give you something to do besides having to go to a 4-year college, which at least my son does not want to go to a 4-year college because he's like, I don't want to have that kind of debt. So he's doing like a technical thing. So, it's just another option for these kids to have something to do. There's so many kids out there who are bilingual, or so many people who are bilingual who don't have a career like I didn't have a career, and could find a good job doing something that they will more than likely love. There's no way you don't fall in love with this field. Um, that was the first thing that I noticed within the first weeks of doing my my from the first weeks of starting was how much I liked it. You feel good. It's so nice to see the patients' faces and how happy they are to see you, and the doctors are so relieved that there's somebody there who can help them communicate. So yeah, I do think that it should be marketed more. Um, just to make sure, try to see if we can have more interpreters because there is a shortage of interpreters nationwide in all languages.
Yeah. Well, and acutely in American Sign Language. Like that's where it
Yes.
was really, really, really felt.
Hmm.
And so that's where you see the most programs like this, where it's like start up an ASL group, get in
Hmm.
front of college students and get them also certified as an interpreter. So I think we're doing it like for ASL. We know that the model can work. I think we're just starting to see that kind of improve, kind of like it'll take some time, but
Yeah.
we can do the same thing for other languages too, because it does seem like there is a shortage kind of across the board.
Hmm.
Mhm. Okay, my second to last question for you. I have one fun question at the end. My
Okay.
second to last question for you. How do you see, we started to talk about this a little bit earlier. How do
Mhm.
you see AI and other new technologies impacting language access in the future? So thinking 20 years from now, what would your hope be for new technology and where could you see it leading?
My hope and the way I see it leading is I see it providing more access to the community in general.
Yeah.
Of course, I don't think that AI can replace interpreters. We just talked about that.
Yeah.
As a whole, there's too many language nuances and languages, and the human component of it and the cultural component of it. Yes, AI is very smart. I don't know if we're going to get to a point where AI will take over the world, but it will be good enough to help us. I think we should be able to work with it, not against it.
Mhm.
I understand that a lot of people, interpreters and translators in general, are very frightened of the idea of AI taking over. But I also believe that as interpreters, we should be able to evolve to different roles. I believe in the CCHI summit, they were talking about interpreters working together with AI,
Mhm.
monitoring the way AI interpreted.
Mhm.
So things like that, I think it's going to be a big thing. It will help a lot with the smaller jobs like registration or wayfinding or for people to have simple questions. Why not? We have interpreters and they're needed for more complex situations where you need to have an interpreter either in person, over the phone, or a video.
Totally. Also, you mentioned wayfinding. I think that's a place that's really hard to solve right now because you have signage, physical
Mhm.
signage that is you have only so much space on signage and you can't necessarily do that. Like language just takes up like physical space. I would love, and we started to kind of explore this, but I would love if you could do like virtual reality, like set your language and then hold up your phone so that you could make all the signage throughout the hospital in your language without having to like print stuff. I feel like that could be cool.
I think that already exists.
Oh, really? Oh,
Yes, I
cool.
think
Send me
Google,
the name.
either Google, I think Google Translate and the Translate app in iPhone, you can kind of go over a text and it'll translate it.
Oh,
It
okay.
is
Yeah. Is it great
not,
though?
I don't know if it's great. I mean, I would not use it for a medical situation, like to do um, a diagnosis or anything like that. But for wayfinding, turn right, turn left, bathroom is here, things like that. Yes, I don't see why not. Um,
We'll play with that.
but see, the other thing is our society is evolving, and we have more and more people who speak more and more languages. I mean, yes, today 80% of our language usage is Spanish, but we have refugees coming in from other areas who speak other languages that we are not used to seeing here.
Mhm.
So, I mean, if you could have some kind of sign where you can press a button and it'll tell you something in your language without having to have like a big sign in different languages,
Mhm.
that would be, we're talking like way in the future, but that
Yeah.
would be something that that could help.
Totally. And also literacy rates aren't always
Hmm.
the same as we would expect. Even when you're talking about the American Sign Language signing population, deaf and hard of hearing population, people are always like, well, just write it down for them. Or like that's not, first of all, it's not equitable because that's not the same way that
Mm-mm.
you're engaging with that conversation as someone who speaks. So not equitable no matter what. And secondly, the literacy rates are not as high as you would expect. So it's
Hmm.
you can't expect that people are going to be able to read to engage with information. So how do we, I mean, the same thing with discharge instructions and like, how do we help provide people what they need?
Yeah. And there you're going to step into the issue that not everybody is technology literate.
Yeah.
So, nowadays the virtual visits is a big thing. You do the Epic virtual visits and
Yes,
it's easy, boom, 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 boom. But what happens when you have patients who don't know how to use technology?
totally. There was a study. Oh golly, I'm digging into the recesses. I spoke about this at the American Translators Association conference a couple years ago, where there was a study. Someone did a study about people of other languages represented in telehealth, and this was earlier in the pandemic. Like it was newer, and I think people are still getting the hang of it, but the for this particular geography, and I can find my stats later, but for this particular geography it was like their in-person population was like 30% limited English speaking, and their telehealth population was 8% limited English speaking. And so that's a huge disparity, especially at a time when it was in the middle of the pandemic and the only way that you were probably getting access was through telehealth. Like you were less likely to be going in.
Oh Lord, during COVID, we stopped going to in-person interpreter requests. I mean, to in-person appointments because the clinics pretty much stopped.
Yeah, yeah, yeah.
But we started pulling lists of LEP patients and calling them and teaching them how to use the my chart and how
Oh,
to,
yeah.
use the technology. Can you use it? Can you not use it? Do you need this? Do you need that? Like we did a lot of work with our patients to make sure that they were able to do their virtual appointments.
Yeah.
um we called patients. Now I'm not going to say most of our LEP patients because I don't think that we got that far. I wish we could. We're only so many. But we did as best we could. We gave each interpreter a list of patients to call, and if they had to call the language line to do it over the phone
Mhm.
because they spoke a different language, then we would do that. But yeah, it was a lot of work, and we still have to do that sometimes. If we see a patient that hasn't had a virtual visit and they send us a request for us to coordinate, the interpreter will sometimes have the interpreters call the patient and be like, hey, do you know how to do this? Have you done this?
Mhm.
Have you done that? Walk them through the process, get them to do the e-pre-check because it's very complicated. And if you don't know technology, even if you do, let's start with that. Even if you do know technology, my mom knows technology. And sometimes you have issues with things like the e-pre-check. You click on something and somehow you forgot to add something and it won't be clear or whatever. It's just, I love virtual visits because they're easy, but at the same time, we have to understand that not everybody is technologically savvy, and the technology is not as easy as we would like it to be.
Yeah, it's true. It really is. Um, okay, great. Well, is there anything that we did not talk about today that you want to make sure that we talk about?
Ooh, I don't know. Well, I mean, I guess since we were talking about like marketing for interpreters, the other thing that for me is important is educating the population,
Yeah. Mhm.
letting them know what their rights are. And this is not to put this on them, like, make them have to request or do anything like that, but at least for them to be able to know, hey, you're supposed to offer me an interpreter and there's no one here. Can you please give me an interpreter? Let them know what their rights are, because until we don't know in the language access departments what's going on until somehow it gets to us because something already happened,
Mhm.
versus if a patient walks in and the staff, it's too busy, they're rushing through it, whatever, and they don't get an interpreter, at least the patient can be like, hey, can you please get me an interpreter?
Yep.
You know?
Yeah, totally. And also there's, yeah, education on rights and what to expect, and also just education on what to expect in general, like what to expect about
Mhm.
your interpreter, and also that an interpreter will be available and that you can ask for one. And also, depending on who you are and where you come from, what your background is, if you're new to this country, if you have a different expectation, if you like, there's lots of different cultural things that can come into play. So also setting the expectation for just like, what's on the other side of that door when I go into
Yeah.
the provider's office? Like, what should I expect? What's normal? I think that's another piece that can help assuage anxiety and like help people know that they can come to the doctor, because that's another piece, is that we're probably underrepresented for some limited English speakers going to their annual visits and those kinds of things. We're probably overrepresented for some limited English speakers going into the ER because of that.
Yeah, and I think that letting people know their rights, like you have a right to an interpreter, it's free of charge, so that you can communicate, will also reduce the amount of times where people are taken advantage of because, I don't know, their Spanish speaking neighbor is like, oh, well, I'll bring you to the thing, I'll interpret it for you, and I'll charge you $100.
Yep.
Because we do see that a lot. And I think, I think that's wrong. You're taking advantage of a person. And if they already have this service and there's something that we can provide for them, if we teach them and we let them know, hey, you don't need to pay $100 to whoever for them to come interpret for you, we provide that service for you free of charge.
Yep, absolutely. Yeah, it's great. Thank you, Leah. This has been
You're
wonderful.
welcome.
I'm going to ask you my last question, which is just a fun question. If you, it's just a question to help people know you better. If you had to be a kitchen appliance, what kitchen appliance would you be?
What kitchen appliance would I be? Oh Lord. I'd probably be my Ninja Foodie, what is it called? Slow cooker. It does everything. It sears, it
Oh,
slow cooks, it's a Dutch oven. It does a little bit of everything. It's very versatile. Yeah, I think I'd probably be that kitchen appliance just because of how versatile it is and you can do everything with it. I like learning. I like putting, learning about different things and being active in different areas. And so that would definitely be, and it's
I
never
love
let
that.
me down.
That's a great answer. Great answer. You get like a lot of like standing mixer, which is my answer. I say standing mixer. Or you get like refrigerator or like toaster or like oven. But you at one time people said, I had one person say knife, which I was a little bit concerning. And also I'm not sure that it I'm not sure that it counts as an appliance, but the reasoning was because like they move with precision. Like I get the reasoning. But I've never had a, what's it called? A Ninja all-in-one, or
I don't even know what it's called. I bought it because well, my husband bought it for me because my slow cooker broke down. But
uh-huh.
it does everything. It sears, it steams, it's a Dutch oven. You can put it in your oven. You can, it bakes.
Cool.
So yeah, I think that would be the one. It's a jack of all trades.
Okay, now I have to go look it up. So you've given me, I'm probably gonna end up with one. So thank you for the recommendation. All
You're welcome.
right, Alicia, this has been so much fun. I am so grateful that you joined us. Um, and I look forward to talking more about language access and innovation at the Language Access Innovation Council.
Alrighty. This was definitely fun. Thank you.
Yeah, bye.
Bye.